welcome to our COVID-19 mandates webinar. We'd like to thank, of course, Hub Engage for helping us put this together. And it's always a pleasure to be able to work with teams and share the information that is happening in the most current landscape. So this course is actually good for one PDC for both SHRM and HRCI. This webinar is not designed as legal advice or law interpretation. This really is strictly an informational seminar on some current topics. Please always refer to your legal counsel and your HR departments before implementing any program or policy. So on the agenda today, we'll talk about COVID-19 update and current statistics. We actually did a different seminar, but on COVID-19 back in June or July. It's very interesting to see how the statistics have changed in the last 5 months and some of the things that are going on currently with COVID-19 regarding vaccinations, infection rates, variants, et cetera. We'll talk a little bit about employer mandates, while the focus today will be mostly on the new OSHA mandate. We will be discussing voluntary and employer mandates for COVID-19 vaccine policies. We'll cover some potential legal issues as regards to the EOC guidance on COVID-19. I've taken a lot of time to do research and provide resource links that are available at the end of this presentation. So if you could please reach out to us and let us know that you would like a copy of the presentation. We'll provide you with the resources that we have. The EEOC and OSHA has a plethora of web links and things that are associated to be able to get to their resources or sample policies, templates. There's a lot of information out there that will help your organization meet some of these new requirements, and it'd be very helpful to have that information handy. And then lastly, we'll end on technology for compliance and talk a little bit about some tools that are out there, and even have a demonstration of a tool that currently in use. All right, so the first question before we kind of get into COVID-19 vaccine and current trends is, I'm just going to ask the audience a question. I said that we would be spending a big portion of our time on OSHA mandates. Any recent news around the OSHA mandates? Any recent news that the audience would like to talk about, or what recently happened around the OSHA mandates? I'm just going to look to see if anybody posts a message there. If not, I'll definitely give it to you. Well, so the OSHA mandate came out. OSHA published a ETS on mandatory vaccinations, and just a couple of days ago, that was actually put on stay. So even though it's been published and it's been communicated and it's out on the news and the landscape, it is in stay. And so even though it's currently not in effect, we believe that it's still valid to go through the proposed changes, the proposed regulations, and give you an update on that. Because as we kind of get through the next few weeks of court cases and rulings, we'll let you know what we think about that. But we still expect some changes to come, so we will still be covering all of those topics. All right, so kind of the current trends from the CDC. I'm not going to hit all of the bullet points. I'll let you take a look at them. And again, this is for informational purposes. The daily new cases from the last 7 days, the CDC measures these statistics from the previous 7 days, and new cases are up 1.4%. We'll talk a little bit more here about that, and we'll look at some of the trends. But that's certainly good news in that the number of new cases is not very dramatic. One of the other things that happened since we did this a similar seminar back in June is that we actually, when we did that webinar, we did not have FDA approval for the COVID-19 vaccine. We got the first approval from the FDA back in August of 23rd. I think that's really affected the vaccine rates, people seeking the vaccine, and of course, lowering the infection rate in new cases. And so that, very significant timeline for COVID-19 and for the vaccine. As of November 17th, almost 60% of the people in the US are fully vaccinated. That's up about 11 or 12% from, in the June timeframe that we revisited that. And then we have people with one dose approaching 70%. So those are really good numbers. As many of you probably have been hearing in your local areas, in your states, boosters are now available. In many states, those are still limited to, people who have immunity problems or serious health issues. But there have been issuing a high number of those boosters to that population, and that's also available. So again, another significant improvement in what's happening with COVID-19 vaccines, making boosters and things of those nature available for that group. Vaccine administration in the previous 7 days up 55.8%, and that's pretty significant. We'll talk more about what those statistics looks like and what we believe are driving those changes. And then lastly, the Delta variant is the only classified variant of concern in the United States. Back in June, there were several others. There were 4 other variants of concern. I think people hear the Delta variant pretty common in the COVID-19 language. Today, it's responsible for 99% of all new COVID cases is as a result of the Delta variant. And so again, that's still very prominent. The Delta variant is much more infectious and it transfers at a higher rate. And so, definitely, I think we see the response from the government and other agencies trying to, get vaccines into individuals to help lower that infection rate. All right, so here are some of the current trends in chart. You can see here that back in fall of 2020, we had our most significant rise. And then they came out with the vaccine. People started to get vaccinated. We started to lower that rate. And you can see that we see some peaks. But then again, in July, August timeframe, those peaked again. I believe that we had peaked late or early April in people getting vaccines that were under the EUA, Emergency Use Authorization. They were waiting for FDA approval, and I think that has again allowed us to get more vaccines in individuals and lowering that rate for COVID-19. This is just a chart on the number of vaccinated individuals, and we've already talked about the percentages. You can see that in some of the other demographics, population 65 years of age and older is at almost 90%. So the numbers are actually pretty high for fully vaccinated. Something that also recently happened that is available is that children above the age of 12 have been able to receive the vaccine, and that's also increased the vaccination rate. Those numbers again are very high. So we just have a lot of folks that have entered this the system in the last few months of this year that are promoting that, receive the vaccine, and really improving that that vaccination rate. And again, here, there's just a graph on where we peaked back in April of 21, and then you can see that peak again starting to rise again, attributed to probably the FDA approval, children being able to receive the vaccine, and then of course boosters. All right, so let's talk about the employer mandates. There have been quite a few lawsuits that have been out there. And some of the ones that I've listed here were some cases that we looked at previously back in June and July. Houston hospital workers at Houston Methodist sued their employer for firing them for not taking the vaccine. Ultimately, the court sided with the employer. There are several other cases here that have been listed that, again, the courts sided with the employer. What we're seeing here with the employer mandates is that more employers are attempting to force vaccinations for their employees to protect the safety of the total workforce. And these consistently are being won by the employers. In other words, courts are citing pretty consistently on the side of the employer that the rules that they've implemented, the policies that they've implemented are justified and are legal, okay? So I think that we'll continue to see that type of a stance from employers going forward, that more employers will be implementing these policies. Now, there have been other employers in the news, specifically some of the airlines who attempted to force vaccinations on their employees. And while they were also met with lawsuits, and some of them have been won, and some of them have decided to put some of their policies on hold. There are other reasons that employers may choose not to force employees to take vaccines or force them into a mandate. There's a lot of other reasons besides legal. There's consumer reasons, there's business reasons, there's effect on the business customers, and of course to the employees. So in the case of the airlines, we've seen them back down and trying to renegotiate. There's other groups like your labor unions and collective bargaining agreements that need to be considered. So again, there's just a lot of different issues for each employer that are unique, and I think that's why it's so important for employers when they're creating their policies that they're developing those policies for themselves, and of course they're unique, and so they're specifically designed for their culture and for their organization. We also talked again that there is FDA approval of COVID-19, and I think that's also helping employers also as we move from EUA to full approval, allowing those employers to ask employees to now take that vaccine. EOC does have guidance here. We wanted to hit some summary guidance on the EOC guidelines. Again, in the links of resources that I have, there are links to the websites for all of these in their entirety. This is just a summary of the highlights, but some of these items have very specific considerations, and the EOC has provided additional links for you to be able to research and understand how these could affect your policies and what you should incorporate into your policies. The first thing is that the EOC does not supersede the CDC, state and local government, and public health authorities. So something you certainly need to be thinking about as you're putting your policies together, that while the federal guidance is out there, the government is providing resources, we always have to remember, the locations that we are at and what local and, public health officials have also put in place, and that those are going to supersede the EOC. I just need to make sure that you're addressing those additional policies. Probably one of the most important one of this group is the EOC recommends that you must consider reasonable accommodations, and it's important. And generally, accommodation is something handled by the HR departments, but here you have all employees now that are subject to these rules. Maybe speaking to their managers, frontline supervisors. You want to make sure that your managers and supervisors and people interacting with your employees are trained in what an accommodation is, that they're clear around the policies for those accommodations. And the other thing too, I think a best practice is erring on the side of the employee, and whether it's a medical or religious accommodation, that you're taking a positive effect to consider that, approve it, and make sure that they do have the ability to refuse the vaccine if it's related to religion or health reasons. Carefully consider incentives. There have been incentives created by employers to pay employees for being vaccinated, giving them a spiff or a bonus. There is a fine line between helping to pay for some of those costs, or rewarding employees for complying, but you don't want those to be significant in that they start to coerce or influence the behavior for volunteering to take those vaccines, and then affecting other policies like GINA and ADA that has very specific policies around what you can do and what you can't do. So just carefully consider incentives, review the rules, and make sure that you're considering that in your overall program. Beware of disparate impact. We don't, again, want to negatively impact or search out a specific group. This is a lot of the times is unintentional. It's not deliberate, but and that should be considered and should be part of your policies. And then the last thing is that we want to keep vaccination records confidential. We want to make sure that these vaccination records are kept separate from the regular employee file, and of course that if they're stored electronically, that they're kept in a manner that is secured and encrypted. Many states have started to come out with specific rules around how you're going to store vaccine information. It is and can be considered medical information, and so that's why we want to store them separate. We want to make sure that we're meeting the record keeping requirements for this type of data. So this will also be included in your policies and in your procedures for implementing these mandatory programs. I'm going to pause here and just do a sound check and everything. Yash, you hear me okay?
Sure can. You're all good.
All right. I just saw an internet pop up on my screen, so I just want to make sure we're still with everyone. Thank you. So some potential legal issues. I mentioned the issue around incentives. There are things that should be considered when you're creating your vaccine mandates. There's the American with Disabilities Act. There's GINA, which stands for the Genetic Information Non-Disclosure Act. And of course, there's also some things with Title VII of the Civil Rights Act of 1964. For the sake of time today and the short time frame that we have and the information that we're covering, we don't have a chance to go into those in detail. But again, there are links in my resources to these to these regulations so that you can go out and review them. The EOC has done a good job of pointing out things that you should look at when you're creating your policies. Incentives should be subject to FLSA rules and non-discretionary bonuses. I think a lot of times there's, there are spiffs and gifts that we can give to our employees that are not subject to wages and taxes. But then there are certain amounts that reach that threshold. Just please, again, consider that in part of your procedure and policy making, and that you have a way to address those and notify employees how those are going to be reported. There continues to be regulatory uncertainty and constantly changing regulation that make this risky. So anything that you implement continually needs to be monitored for any updates and changes, and not only at the federal level, but also at the state and local level, making sure that you're compliant and that you meet all the latest rules. So again, because it's just so volatile, that you're taking the time out there to make sure that your policies are still in check. A proof of vaccination should be considered medical information and subject to data and data breach requirements. We talked about that in the previous slide, that their states, California specifically, have started to come out with steep fines and penalties, requirements on how the data should be stored. So again, depending on where you're located, you're going to make sure that you're looking out for those type of regulations and that you're compliant. And then just last, privacy concerns, right? We are legally able to take people's temperatures and ask them for a proof of vaccinations. But again, we want to make sure that all that information is private and is only shared with the people that need to have it, and the agents of the employees, et cetera, and that's being handled properly. Okay. So best practices for COVID-19 vaccine mandates: clearly communicate your intent, whether it's mandatory or voluntary, and just making sure that there's a good communication plan so employees clearly understand what the requirements are, what the consequences are, what their rights are, et cetera. Make sure that your policies are clearly defined for reasonable accommodations, and make sure that that information is communicated to all of your supervisory and managers so that they're handling those appropriately. You want to make incentives tied to voluntarily accepting the vaccine and tied really to proof of vaccination. Employers should consult with local and state authorities and occupational safety and health administration. Different requirements. And then lastly, the manual personnel file that's separate, or it's electronic and you have it stored electronically. All right, so let's talk about the OSHA mandate. Got quite a few slides. Again, the OSHA mandate is on stay, but we decided that we would go through with the seminar and discuss the summary of the mandate so that you're prepared. Experts really believe that based on what we're seeing with employer mandates out in the landscape, that OSHA will most likely prevail. There may be some changes. There's a lot of questions about OSHA overstepping their bounds, that it's unconstitutional. We're going to see that in the next few weeks or months out in the court systems. But at the same time, there's a lot of preparation that's going to be required for this OSHA mandate if it does go through. A lot of infrastructure that may or may not be in place. If you have already implemented an employee vaccination mandate, then you're probably way ahead of the game, right? But if you haven't, then there are things that you're going to, infrastructure you're going to need to put in place in order to be compliant. Experts are suggesting that it's a good idea to still go through those motions, go through implementing those policies with the tools that they've recommended. And in the event that it does go away, you're still ahead of the game. But if they decide to put it back into effect and accelerate the timeline, then again, it's going to be a catch-up game for those employees that are still waiting to see what's going to happen. So let's talk about the stay. So this was obviously promoted by the Biden administration for COVID-19 to help get people vaccinated. And then on November 4th, 2021, OSHA announces its emergency temporary standard. We'll call that the ETS for large employers who are 100 employees or more. The issues that states have sued over is that, if it's good enough for employees of 100 or more, why is it not important enough to also subject small employers to this rule? So that's one of the big items that's been called out that may change as we kind of move through this landscape. On November 12th, the U.S. Court of Appeals for the Fifth District Court granted a motion to stay OSHA's COVID-19 vaccination and ETS that was published on November 5th in the Public Register. Okay, so just a few days later, it had to recall and put that on stay. So right now, we will be reviewing the proposed regulation and going through a summary of the various items. We've already talked about this, but ETS currently was proposed to be for large employers large employees that have 100 or more employees, requiring protection for unvaccinated employees. Now, unlike many of the employer mandates that are out there who are terminating employees for not being vaccinated, OSHA's taken a different approach. They are requiring that there be policies for vaccinations, but ultimately what they're after is to protect unvaccinated employees. And there's a number of ways they're going to be doing that. They're going to be doing that with COVID-19 testing on a weekly basis, enforcing the use of masks for unvaccinated employees. Vaccinated employees will certainly have a choice, but for those that are unvaccinated, they will be required to wear a mask and take weekly tests. The ETS preempts state and local laws. And again, those are a lot of the basis for the lawsuits, is that this OSHA mandate supersedes all other state and local laws. Should also be noted that the ETS serves as a proposed final rule for this OSHA mandate during its temporary standard. So, employers should submit comments and recommendations during this process to help influence what that final standard will look like. Understanding the ETS. Employers covered by the ETS are all workplaces that are under the OSHA's authority and jurisdiction, including industries as diverse as manufacturing, retail, delivery services, warehouse, meatpacking, agriculture, construction, logging, maritime, and healthcare. So basically, everything covered under OSHA. Workplaces that are not covered by the ETS are going to be the contractors and federal contractors and subcontractors that are under a different rule, as well as healthcare services or healthcare support services that are subject to the requirements of the healthcare ETS. And so this does not apply to these groups. This is again strictly for the groups we just mentioned previously. Understanding the ETS, employers of covered employers not subject to the requirement. Those employees who do not report to a workplace, workers that are not present with other coworkers, or employees that are working from home, or employees who work exclusively outdoors. So those work from home employees, those employees that work in a location by themselves, or those who exclusively work outdoors are not covered by the ETS. This is the one that if you've been watching the news and listening to the experts talk about the deadlines, the ETS, though on stay, when it was effective, had two provisions to be compliant. 30 days from publication for requirements other than testing. And that deadline without there was December 6th, 2021. And then 60 days after publication, the testing for employees who had not received all of the required doses and were on maybe on an exemption that were going to require COVID-19 testing weekly every 7 days. And so these dates were published in all of the material. The news systems were showing these dates, and I think that they may change, but again, these are dates that are something that we should review, and that the deadlines for these would approach by these dates. Okay, so now let's talk a little bit about how to protect workers from COVID-19. So we talked about what the mandate covers. Now let's talk about some of the other things that OSHA is recommending, or rather that OSHA is mandating to protect workers from COVID-19. And basically, the ETS is establishing vaccination verification, face coverings, and testing requirements to protect all employees in the workplace. The key requirements of the ETS for COVID-19 protection is that the ETS requires covered employers to develop, implement, and enforce a mandatory COVID-19 vaccination policy, with an exception for employees that instead establish and implement and enforce a policy allowing employees who are not fully vaccinated to elect or to undergo weekly COVID-19 testing and wearing face mask coverings at the workplace. And so, as mentioned earlier, the OSHA mandate is not requiring vaccinations, but it is requiring testing and face masks for those who aren't. And if you implemented your own policies, that's okay, but they must also include, weekly testing and face masks as well. And so as long as you're compliant with that in your own policies, then, that's fine. The DHS requires employees to determine the vaccination status of each employee, obtain acceptable proof of vaccination, maintain records for each employee's vaccination, and maintain a roster for employee vaccination. So like these are the elements that will be required by employers to track as they enforce this mandate. And so these policies will need to be implemented, and you'll need to have infrastructure to be able to do all of that, to be able to capture all of the information that's required. The ETS requires employers to support vaccination by providing employees reasonable time, including up to 4 hours of paid time to receive each vaccination dose, and reasonable time and paid sick leave to recover from side effects experienced following each dose. Okay, so that is part of the mandate as well, to allow employees time to be vaccinated, paid time to be vaccinated, time for recovery for symptoms of side effects from the COVID-19 vaccine. And of course, there's many more considerations there. This is a summary, but in the resources link, you can click and read all of the requirements for record keeping. The other element is for employees who are not fully vaccinated. The ETS requires employers to ensure that each employee who is not fully vaccinated is tested for COVID-19 at least weekly, and if in the workplace, at least once a week, or within 7 days of returning to work. Okay, so you're going to need to develop the infrastructure to be able to record and capture that information and report it, and make that a part of your record keeping, as well as something that you may need to produce to OSHA if so required. So employees are also, employers are required for employers to promptly provide notice when they receive a COVID-19 test or diagnosis with COVID-19. So employers are going to have responsibilities now, right, with people who report that they have COVID-19. We need to immediately remove any employee from the workplace, regardless of their vaccination status, who received a positive COVID-19 test or diagnosed by a licensed healthcare professional, and then keep removed employees out of the workplace until they meet the criteria for returning to work. And again, this is just a summary. There are other requirements that are available in the ETS summary, or listed in the preamble of the ETS that's been published. Another key requirement for protecting workers is face covering. The ETS requires employees to ensure that each employee is not fully vaccinated, wears a face covering when indoors or when occupying a vehicle with another person for work purposes, except in limited circumstances. And so, if you're in a manufacturing environment or somewhere where your mask could get caught up in machinery, I'm making an example, then of course there's certain limitations. They're not going to supersede the safety of those employees in those circumstances. But again, the idea is that people wear face coverings when possible when indoors. More on face coverings. The ETS requires, I think that's a duplicate slide. Sorry, guys. I may have gone back there. How to protect employees. Information provided to employees. The ETS requires employees to provide employees the following in a language and a literacy level that the employees can understand. So again, in that link of resources, there are notifications in various languages, but ultimately the employer is responsible for making sure that that information is accessible, it's available in their language, and that it's at a literacy level that that employees can understand. One other thing that will be required in the OSHA mandate is that fatalities and hospitalizations will need to be recorded. So again, just like many other OSHA reporting requirements, and the ETS requires employers to report work-related COVID-19 fatalities to OSHA within 8 hours of learning about them, and work-related COVID-19 inpatient hospitalizations employee learning about the hospitalization. So again, that employers will be responsible for reporting. All right, so let's talk about COVID-19 policies and other tools. Again, in my resources links, there are things that are out there for EOC, from OSHA. There are sample vaccine policies now that OSHA has put out for you to model. Of course, all of those tools are only meant for reference and to assist you with some of these policies. You should make sure to visit with your legal counsel and your HR departments on the final language and get their approvals. But there are many tools that are out there. If there's something specifically that you're looking for, please let me know, and I'd be glad to look in my tools and forward anything that might be useful for you. So in conclusion, I think employer mandates will continue to be an effective tool to help keep employees safe in the workplace. And so whether you will be following the OSHA mandate or employers choose to create their own mandates with the elements that are included in the OSHA mandate, I think that they will continue to be an effective tool for keeping your employees safe in the workplace. I think that the ambiguity and uncertainty of the COVID vaccine mandate will continue for a while. Experts believe that the stay is only temporary as the court sorts it out, and you should watch closely and still prepare, or the best practice might be to still prepare for these rules. In preparation, develop your infrastructure for support, for face mask policies, for vaccine mandates, for employee notifications and education, making sure that employees understand their rights, policies for reasonable accommodations, and making sure that you're able to capture the right information for your OSHA reporting requirements. So let's talk a little bit now about technology and some of that compliance. I mean, how do you propose to capture that information? There are a number of tools out there. I know many HRIS systems have started to provide areas for you to document and record that. There are many other technologies that are out there that are available. You want this tool really to be simple, preferably mobile technology. I think is preferable, something that everybody has access to. I know particularly in a lot of the industries that OSHA the OSHA regulates, like manufacturing and production, computers aren't always available. So I think mobile technology makes it simple for everyone to have access to be able to properly report the requirements, as well as recording the information to be able to report and pull statistics. And so some things that I think should be covered by the technology are recording proof of vaccinations, surveys or questionnaires around symptoms for COVID-19. And then, of course, all of it has to be accessible for record keeping and reporting. So at this point in the seminar, I want to pass a few minutes over to Yash Chitre with HubEngage, who would like to do a short demonstration on some of the technology that's out there and show what's available for employers. And of course, if you're interested in looking at this technology, you can certainly contact him for more information on this particular topic. So Yash, can you go ahead and want to take back presenter controls?
Yeah, absolutely. Thanks, Chris. I think you just need to stop sharing. And as soon as you stop sharing, I can share.
Yeah, and I'm going to be looking at the chat, Yash, and seeing for any questions, that are out there. So while you get set up, Josh, there was a question about, in your experience or opinions, could the dates change for I would think how long this is reviewed out in the courts and how long it takes for the courts to decide whether or not. And I'm going to go ahead and let me stop sharing here. All right, try that, Yash.
Yep. Oh, so that's...
Yeah, I think that there will be some adjustments on that. It's too soon to tell how long it's going to take for that to sort out, but I think that they would have to make some changes and allow employers to be compliant. On the same token, I think it's good to still move forward and try to solve some of those problems before that happens.
Yeah,
all right, Josh.
In that same respect, I would agree with Chris. I know a lot of organizations they want to be prepared. They want to have something in place. And at Hub Engage, we've kind of stepped up to the plate and created a free tool to help you with that. Now, Hub Engage itself is a fully customizable employee experience platform that does a lot of different things. We do employee communication, social engagement, recognition, feedback surveys, learning, instant messaging. And we do it all through employee apps and intranets and digital displays and email campaigns. So if you go to hubengage.com, you could definitely get more information about our entire product, but specifically about the Vaccination App. And if you click on right up top here, you'll get to this page. And this page basically explains everything that we are offering right now. So what we did was we just created a very free, easy to use tool here that can track vaccination status, provide testing results, and can also screen for symptoms to keep your workplace safe. So it's very simple to do. You can scan this QR code with your phone, or you could click the link and you could go through the experience. And I'll show you that in just a minute. But very easy to do. And if you like what you see, you can get your own version going right away. So, you just fill out this form really quickly. We'll get you set up. There's a nice video here that also explains it in, under a minute. So, you'll have all the information you need. But basically, it's very easy to set up. You can download, you can use our template, or you can create your own, and you'll have your own vaccination tracking forms. Your employees can update you on a weekly basis there. You'll get a QR code. You can put it up on posters at your facilities. Your employees can quickly scan that code with their phones or tap a link in their notification email. They can fill out, submit that form. And the best part is we automate everything for you. So we can send you an alert, and that can be sent to a specific contact, a supervisor, when any employee reports a positive test. And, as with all of our technology, we have, built things to integrate with what you have in place right now. So you can embed, publish this vaccination tracking app on all sorts of things. So you can use it within the Hub Engage employee app if you're already a Hub Engage customer. But if you're using Microsoft Teams, Workplace by Facebook, Slack, SharePoint, any other HRIS employee comms platform, you can put that widget right there and people can get access to it really, really quickly. So just to quickly show you, if you were to try our demo and you'd click here, you'd land here to our turn on engagement page here, which is just our demo form here. So you've got two choices. You could submit your vaccination record, you could submit your test results. So this is just for you to try it out. But to take you through the experience, you would just quickly fill this one out, form out. If you don't have an employee ID, you don't need that per se, but you can capture lots of different fields based on how you want to identify your employee audience. And you fill out the form, very, very easy to do. So I had the Moderna vaccine. When did I take it? Oh, well, I just had my booster the other day, so I'll just say that and indicate that. I can upload a copy or an image of my proof as well. And then you can capture signature. So I could quickly just sign this and submit and be done. So this is a great, easy way to have the compliance should OSHA decide to do this mandate, or if you are just interested in doing it for your organization because you have your own compliance needs or your local compliance needs or industry compliance needs, or you're just creating a safe workplace environment for your employees, you can easily have this set up in place as well. Now you could also do test results as well. So in this one, it's a very similar form. And again, I'll just take you through the experience here really quickly. So I'll just answer these questions. Have I been tested? I have not been tested. If I've been tested, I was not tested. And then I will just say, do I have any of these symptoms? And these are all symptoms. This templated form is all taken off of public health sources of recommended questions to be asking, right? So this is coming straight from, the commissioners of public health. These are the types of questions that they are recommending employers ask their employees. So I will just fill this one out, go to the next one. Did I have to quarantine? No, I did not. I have not been exposed. And then again, I could upload my COVID test results here very quickly. And then you can also capture your signature as well and submit this and be done. So you've got two choices there. And again, this is 100% free. We are offering this and giving this away, whether you're a HubEngage customer or not. If you are a HubEngage customer, you can get this going right now, right away. Most of our customers are using this because it's just an easy way to track. But again, you don't have to be a customer, so anybody can try this out. So definitely, I'll put this link over into the chat as well, so everybody has this. And I believe Chris has a copy of this in his links that he's going to share. But you can get started with this anytime you'd like. And of course, if you want to explore it further, you want to chat a little bit more with us, all you do is just contact us, and we're happy to have a further discussion with you as well. So that is the tool that we are offering. Chris, back to you.
Thank you, Yash. We have about just a couple more minutes left. I did see a question about a large employer who has 2,500 employees, multiple locations. Are they still subject to follow the ETS? I will do some further research and respond to that participant directly. Here's what I know. I mean, there are many other factors that would need to be considered. Are they multiple FEIN numbers? Are they considered separate businesses? Do they fall under one? Generally, even in that regards, they're still subject to the rules. So let me do a little research on that and get you a better answer. But my instinct tells me that you will be, and just because there are different locations, same organization, that they would be considered in that large employer group. I'm going to check one last time here.
There was one question from Maria about updating screening questions when needed. So we have the template. We would have the template set up for you with all the questions populated there, and you can continue to use those same questions week after week. But you have the ability to edit it as well. We realize that you might have more specific things you need to ask, or you just you want to customize it a little bit more. So think of the template as a good starting point. A lot of companies just use it as is because it's got all the vital questions to ask. But you can edit anything you want, and of course, you have access to all the data, and you'll get the results and the reports, and you'll get all of that from your backend dashboard link, which would all be set up for you as well.
All right, so we're right at time. Any other questions in there, Yash?
I don't believe so. I think we got to everybody right on time.
So I wanted to thank everybody for information with you, and we're look forward to future seminars and any way that we can assist you with this topic. All right, thank you very much, and have a great day.
Thanks, everybody. Have a great day. Bye-bye.